This oral solution is designed to help replace fluids and important minerals like sodium and potassium that are lost due to diarrhea and vomiting. It can help prevent or treat dehydration, which is essential for the body to function properly. It's important to make sure your body has the right balance of fluids and minerals for overall health. The recommended dosage and optimal timing for taking this solution will be based on the individual's specific needs and should be discussed with a healthcare professional. When taking Hydralyte oral solution, it's important to follow your doctor's instructions or the directions on the product package. Some liquid forms need to be mixed before using, while others should not be mixed. If your liquid form is a suspension, make sure to shake the bottle well before each dose. For the powdered form, mix the contents of the packet in water as directed on the product package and stir until completely dissolved. Do not heat the product unless the package states it is okay to do so. The dosage of Hydralyte oral solution is based on your medical condition and how you respond to treatment. It's important not to drink fruit juices or eat foods with added salt unless directed by your doctor. If your condition worsens, lasts for more than 24 hours, or if you experience severe stomach/abdominal pain, blood in the stool/vomit, a fever, or signs of dehydration such as dizziness, decreased urination, severe thirst, very dry mouth, or seizures, make sure to contact your doctor right away. If you think you may have a serious medical problem, seek medical help immediately. If you experience mild nausea or vomiting after taking Hydralyte oral solution, try taking it slowly in small amounts with a spoon to decrease these effects. If these effects persist or worsen, contact your doctor or pharmacist. Remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Most people using this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience any serious side effects such as dizziness, unusual weakness, swelling of ankles or feet, mental/mood changes, or seizures. Although very rare, seek medical help right away if you notice symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, make sure to contact your doctor or pharmacist. As for the best time to take Hydralyte oral solution, follow your doctor's instructions. If you have any concerns about the daily dosage or optimal timing, it's important to consult your healthcare provider. Before taking Hydralyte oral solution, it's important to talk to your doctor or pharmacist if you have any allergies, as this product may contain inactive ingredients that can cause allergic reactions. If you have certain health problems such as severe vomiting, difficulty urinating, or intestinal blockage, it's best to consult your doctor or pharmacist before using this product. Additionally, if you are pregnant or breastfeeding, it's important to discuss with your doctor before using this medication. And before having surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. As always, it's important to follow your healthcare professional's advice on the best time to take this medication and the appropriate dosage for your specific needs. When taking Hydralyte oral solution, it's important to be aware of any potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Always keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, be cautious of any mineral supplements, such as potassium, as they may interact with Hydralyte oral solution. Be sure to consult with your healthcare provider if you have any concerns about potential drug interactions. If someone has taken too much Hydralyte oral solution and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911. Otherwise, contact a poison control center for guidance. In the U.S., you can reach out to your local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center for assistance. Make sure to attend all of your scheduled medical and lab appointments. Once you start feeling better, you can begin to eat gentle, mild foods like rice, bananas, toast, boiled potatoes, or other foods that your doctor suggests. This oral solution is not applicable for use It is important to follow the instructions and guidelines provided by your healthcare professional for the proper use of this medication. Be sure to consult with your doctor regarding the appropriate dosage and timing for taking this medication. Be sure to check the storage information on the package and ask your pharmacist if you have any questions about how to store the medication. Keep all medications out of reach of children and pets. Do not flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. Properly dispose of this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.